Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Jason Teeple. He's co-chair HL7 FHIR at Scale Taskforce and senior director enterprise architecture and interoperability strategy at Evernorth and Duncan Weatherston. He's co-chair of the HL7 FHIR at Scale Taskforce and CEO at Smile Digital Health. Welcome, guys.
Hey,
Hey,
thanks.
thank you for having us.
Yeah, excited for this discussion, talking about FAST, a really important part of HL7 FHIR's efforts, and excited to share more with our audience. Duncan, why don't you kick us off? Tell us a little bit about yourself and the HL7 FHIR at Scale Task Force, or FAST as it's known.
Yeah, hi there. I'm Duncan Weatherston. I'm one of the founders of Smile Digital Health and the CEO. I've also been co-chair of the Fire at Scale Task Force for the past couple of years. And in that time, we've sort of seen it move from a CMS-driven project through an HL7 accelerator. And it's focused on infrastructure for the deployment and use of fire across the healthcare industry. Our vision is about creating a set of infrastructure components, specifically around security and identity, consent, directory, testing, and a few others to be able to deliver foundational pillars for interoperability. You can't reasonably expect things like security to happen piecemeal because everybody has to sort of collaborate ahead of time. Same thing for the other elements like consent and directory. It's critical that these be well established and consistent across all the participants, and making that real and working with partners like Sequoia and all the other members of the ecosystem is really kind of at the base of what we're up to. So as we go forward, you'll see that we've put a lot of stress on making sure that this is easily deployable. We're going to provide real-world implementation that people can just make copies of and use directly. The whole goal is infrastructure, easy to deploy, and consistent.
That's awesome. Jason, how about yourself?
Sure, Jason Teeple, and from Evernorth Signa Group, been within the interoperability space for many years, and like Duncan, have been a co-chair for the Fire Scale Task Force for the last few years. Um, the Fire Scale has been really passionate project for the Signa Group because one of our founders for FAST is a colleague of ours, and we see this as really the opportunity to help the industry kind of take the fire implementation guides and put them to use at scale. And that's really where CMS and ASTP are trying to go. Like, how do we make this data liquid, especially for the patient? So it's really important to kind of start connecting all these dots. And that's where FAST kind of fits in with all these conversations.
Well, let's dive into that a bit more. I mean, there's so much activity in interoperability right now, especially from CMS and ASTP So, how does FAST fit in with their interoperability vision?
Absolutely. So it's really exciting, but it's also kind of nerdy, right? It's the stuff that happens behind the scenes. That's where FAST really kind of specializes. Everyone just assumes the network is there, but we're really the connectivity tissue behind where CMS and ASTP are trying to go. Because when you want to go out and connect to another organization, you need to know where to go. That's where the national directory comes in. But you also need to have some trust and security behind that. So that's where we have our identity and security concepts come into play. And then once we have all that connectivity there, you want to know that you can safely share that information, especially from a patient perspective. So that's where consent comes in. So we can kind of, our implementation guides set the guidance together. So then we can start building this larger network. So then where you have TEFCA coming in, we have all these aligned goals and we're repeating our processes instead of having to go out and build out, custom niche architectures for every integration. We want to get away from that. We spend way too much time and too much mental power on all those conversations. Let's build a common, reusable, scalable architecture to underpin where CMS is trying to go with 0057. So you think about payer to payer, provider access, the burden reduction. Those all need a scalable network in order for this to be successful. So that's where FAST really kind of helps fit in and shines, I believe.
Yeah. Duncan, what would you add in and talk about how FAST is kind of moving interoperability from a compliance thing that you had to do for EHR certification, which we saw during Meaningful Use, I think, to really collaborating together and kind of Jason's vision of build once and it works across all of it.
So yeah, I wouldn't add much to what Jason said, but thinking about how you move from compliance to collaboration, the history of fire adoption, a lot in the payer and provider space, and especially in the US, has been driven by government mandate. The the communities that we work in don't tend to adopt new technologies for IT without strong justification. And so compliance has been a bit of the sort of motivator in getting people to adopt these technologies. However, these technologies are foundational in the ability to deliver value in new and interesting ways across the entire um, ecosystem for healthcare, whether you're a payer, a provider, a researcher. The use of structured and semantically interoperable content is widely broader than what's envisioned by the simple mandates that we have. And so what you think about is you get incented to adopt a technology, and then that technology has something like FAST, which enables collaboration directly, enables things like security and consent. And so it's a framework and infrastructure that enables the use of this semantically clear language, the semantically clear content amongst the participants. And then on the tail end of that, you end up with this opportunity where each of the participants can come up with their own use cases, relying on security, relying on privacy, relying on identity and directory and all these other layers that are in there to make it possible to find each other, to share with trust, to be able to be assured that the use of the information won't come with legal burden, as a consequence of exchange under HIPAA and other types of privacy legislation. And so with all that infrastructure and that sort of motivation in play, the compliance that you had to do to get the technology becomes tomorrow's opportunity for collaboration. And we see the community move towards a broader use of information as benefits patients and as benefits, the cost of care.
Yeah, it's interesting that you both mentioned security. Jason, I'd love to hear, like, how does fast security enhance the security for FHIR users on TEFCA and also kind of support a scalable or trustworthy digital identity, which, that's the buzzword of the day, I think, digital identity. But yeah, I'd love to hear how fast security is supporting all these efforts to secure it.
Yeah, absolutely. So think about what we do today as organizations. We go out, we want to integrate with another organization. We have that conversation. It then takes months, 2, 3, 4, 5 months to get the integration stood up because we have to go out and have a conversations of what does this technology look like? What are your standards? What are my standards? We have to evolve as an industry to be taking that month conversation or multi-month conversation down to minutes. And that's where fast security comes into play. We want to have security that is policy driven, that's token based, authorization patterns, so we can have a cross network data exchange. And that's going to be really critical. We can't spend months going out having these conversations when we have to connect with hundreds of payers, thousands of providers. That's just not reasonable, especially when we look at the regulations. We're all going to have to interconnect in some capacity, and having the fast security in place allows you to have that certification-based exchange. And what's great about it too, if you find a malicious actor, you revoke their access and they're gone for everyone. It's not just for one organization. You have to go do that 100 or 1,000 times for every other interaction. It's once. You take care of that, and that's great. But once we have the connections for all these systems, now we have to get into the idea of how many usernames do I have for every website that's out there? And that's where a federated digital identity comes into play. So we can start trusting the same identity across all these organizations. That's really going to help the patient. And that's what's critical here, right? We want to make things easier and remove the abrasion for a patient. And so that federated identity really kind of takes it to the next level for us. So there's a lot of we have to look at it from the patient perspective, but also behind the scenes with the systems. So that's where the security piece comes in for us.
Interesting. I think beyond digital identity, the other hottest topic is national directories. It's getting, I mean, it makes sense. CMS
It
has
is.
focused a lot of effort on these. Jason, how is FAST National Directory supporting the CMS provider directory and the U.S. digital service modernization? And what does a unified trusted directory mean for, basically what you said, the trust and integrity of the network and the transparency between it so you can trust it?
Yeah. So I think we have to take a step back. A quick story is about a year ago, Doug and I sat down and said, the directory IG that we have in place today isn't going to support where we think that CMS has to go. So I believe we took a little bit of a bold decision to say, let's just strip this down and do the right thing here. And once we did that, that's when we actually saw CMS come to the table and say, hey, we want to partner with you on this national directory, because we both recognize that there are a lot of directories out there. Every payer has their own directory. There are companies who have directories. There are companies out there who say they are going to fix every directory. That to me shows that this should be a commodity, something that we all can take information from one source of, truth, and then federate that information out. And that's what we're trying to accomplish here with the National Directory. We want to be authoritative. We want to drive the trust and discovery of all that information that is the underpinning for a lot of the interactions between a provider and a payer, for example, right? So you think about an authorization. You want to make sure that the payer knows who that provider is and how to interact with that provider. And that provider wants to know who that payer is and how to interact with them. Having this national directory helps build that trust and discoverability, and also make sure that the information for payment, for example, is consistent between both organizations. So we can speed up a lot of those processes. And there's a lot of integrity through that process as well. So having all this transparency is really effective. And that's what we're trying to accomplish with the National Directory. We partner very closely with CMS through our work groups right now to help drive where we want to go with this directory.
That's awesome. Duncan, what would you add? I mean, to this idea of making it not universal, but at least, easier to onboard and portable, the identity, the directory, we could throw in consent portability as well. I'd love to hear, how is that going to help, empower patients and kind of streamline this sharing that can happen?
So I think it's really critical to examine all new digital services in the context of what's gone before. And if you look at the way we've been successful in other areas of endeavor online, if you look at things like DNS or websites or email, there's a set of characteristics that are essential for global adoption. And the first one is that the standards are applicable and available to the users in ways that matter to them. The second one is that there are consistencies amongst the users in their ability to exchange information. And then lastly, that there's mechanisms which are consistent to be able to trust the systems to share information aligned with your wishes. I mean, and what we see is, where that doesn't happen, there's a lot of consternation, right? And so the directory engagement gives us the opportunity to be able to sort of identify who's participating. Identity gives us a level of trust that the people we're accessing are people we expect to access. But at the crux of it, from a privacy perspective, and this is going to be really important as we start to see the access to information more ubiquitous, and as we start to see the collaboration we were talking about, we really do need to see the ability for people to be able to express their desire to constrain what information about them is shared, or at least have some degree of control over it. If you feel your information that is very private and personal is being distributed without your awareness and without your control, you're likely to draw back and not participate. And that would be really problematic in a realm like healthcare. So the idea behind the consent portability is to make it possible for any member or patient to be able to express what information they would like to have shared about them, or if they'd like to participate at all in a way that they can trust. And the whole goal behind the idea of consent portability is to have a common way of expressing those patient goals and those patient constraints objectively across the entire landscape, to enable everybody who's got information to assess whether or not the patient would want that to be shared and whether they have participation willingly. And that informed consent is really the backbone of national legislations globally, and certainly a critical element of what we're trying to accomplish at FAST.
Love that. So Duncan, talk to me, like, what are the implications for states, for payers and vendors that, that are ready to operationalize these standards? And we've kind of painted a rosy picture, right? A beautiful directory, security that's perfect, with consent that's portable, right? So I'd love to hear, what are the implications for them, and what do they need to do to really make this a reality, as far as adopting it and making sure that this does come to fruition?
So I think the critical factor for adoption of any standard is value. I think the way that we go about achieving that value is by having real world objectives that are set by policy, and occasionally set by mandate. I think it's really important that the states and the participants look at what's out there and make rational selections that allow everybody else to follow along, right? One of the big risks that you face in innovative ecosystem is that people, innovators being what they are, will do things their own way. And I strongly encourage people to do things their own way. However, for core infrastructure elements, what's really critical is that they look at infrastructure as what it is, right? Think about what happens if your railroads don't line up. We've seen it, where you have to change entire train systems because they got to a point of adjacency and then didn't work anymore, right? The whole goal here is to make sure the tracks all fit, to make sure that when you're moving across states, when you're moving across organizations, when you're looking at how do I exchange information effectively, the tracks are all lined up. And to get there, all of the people building the tracks have to do the same thing. So the uplift for the states is understand the standards, recognize the value, and then be able to present it in context in your mandates. And that goes at the nation level, that goes at the organizational level. If you're a federation, participate this way. And more importantly, join in. And we're going to talk about this at the end, is how you join in. But join in, join fast. Join Da Vinci, join the various implementation groups who are trying to build out this roadmap for everybody and help us all fit together. Karen, there's so many, Gravity and Vulcan. There's all these people who are building the future, and there's an opportunity for everybody to get involved. And if you get involved and if you follow the standards and you sort of participate in encouraging others to do so, we're really going to see this move the way we want.
Yeah.
Yeah, I think that's really important, Duncan. And the way I would also frame it is that be be open to education, learn, be open to taking a different approach. Because when we look at it from whether you're coming from a vendor standpoint or a payer standpoint, we all have our own security teams. We all have our own perspective on things. But from our perspective right now, from Duncan and myself's perspective, we want to make sure we can educate everyone so everyone can be on the same page. Because it's really important for us to be trustworthy organizations, but also we have to be there kind of supporting each other at the same time in order to do the right thing. And that's ultimately what it comes down to. We want to do the right thing. So however it takes for us to help educate all those other teams, whether security or CEOs or even the day-to-day people who are doing the coding, that's what's really important here.
Absolutely.
Yeah. So Jason, FAST is kind of entering a new phase of testing and implementation, and I'd say maturity even. What's next for 2026, and how will these standards evolve to support real world pilots and adoption?
Yeah, this is where it starts getting exciting, right? So let's set the framework of 2027's the go live for the CMS regulations, right? We have to start testing, whether it's a national directory, the FHIR over TEFCA, the consent portability, identity federation. We need to start testing all those. And that's what we're going to focus on going into 2026 is making sure that we have test base for each of those concepts. It's really important to have the tools to make sure that we can check that conformance is there. We want to make sure that there are reference implementations. This goes back to the education piece. It's easy to say, here's an implementation guide. It's way better to say, here's the implementation guide and here's a reference implementation, how it should be working. And that gives a team a leg up on making sure that we can be partnering better across the industry. So big thing for us this year, looking at this national directory with CMS, making sure it's ready for them and that we get the appropriate updates in all of our implementation guides. And then the consent piece, as Duncan mentioned, that's really important to the patient. So we want to make sure that we're, spanning that across all the viable options consumers.
Yeah. Ambitious roadmap in 2026.
It
Love
is.
it. But Duncan, as we wrap up, you mentioned people can get involved, which I think is a cool part of this effort as well. So where can people go to learn more and join FAST?
So you can find FAST by searching for FHIR at Scale Taskforce or FAST HL7 or any combination of that in Google. You can find the variety of pages we have. But there are basically four large projects that you should be really thinking about. There's the security and scalable registration, authentication authorization. That one has a project page under authentication authorization. Project meetings are available Tuesdays on the 2nd and 4th of each month and at 11 a.m. And there is a chat.fire stream for each of the working groups. So we have the directory working group. Same thing, there's a project page for it. And then there are meetings the second and fourth Mondays at 3 p.m. And then the interoperable digital identity one, the meetings are on the first and third Thursdays of each month at 2 p.m. And then lastly, the consent. The meetings are on Friday, the second and fourth Fridays of each month, at 2 p.m. as well, all times Eastern. And then, obviously, you can look us up as well individually, and we're always happy to respond and reach out to contacts.
Awesome.
Absolutely.
Well, Jason and Duncan, I appreciate you both taking time out of your busy schedules to share about FAST and all the efforts to standardize things that are really important when it comes to data sharing and trust in the network. So thanks so much for talking with us, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast application. Thanks, guys.
Thank you.
Thank you.